Distinguished guests, colleagues, ladies and gentlemen, welcome to the regional workshop on accelerating AMR action through antimicrobial stewardship in Europe. My name is Sabiha Isaac. I am chairperson of the Global Respiratory Infection Partnership, sponsored by an unrestricted educational grant from Reckitt in the United Kingdom. Reckitt has sponsored this pharmacy-led stewardship initiative in partnership with the International Pharmacy Federation since 2019. It is now my pleasure to introduce the AMR advocates for the region who will be facilitating the workshop. Our first advocate is Phillip Howard, who is president of the British Society of Antimicrobial Chemotherapy and AMR Regional Antimicrobial Stewardship Lead for the NHS England and NHS Improvement North East and Yorkshire. He is a member of the UK Department of Health Advisory Group on AMR and Healthcare-Associated Infections and spokesperson for the Royal Pharmaceutical Society on Antimicrobials, the Antibiotic Action, and British Society of Antimicrobial Chemotherapy Charities. Professor Howard is a fellow of the Royal Pharmaceutical Society, has won the GHP GSK UK CPA Clinical Leadership Award and the UK CPA Lifetime Achievement Award, as well as an OBE for his services to healthcare. Our next advocate is Elsa Lopez Pintor, who is assistant professor at University Miguel Hernandez of Elche, Alicante, in the southeast of Spain, member of the research group in global health, and researcher in the Biomedical Research Networking Center for Epidemiology and Public Health in Spain. Her research focuses on pharmaceutical care services, mainly in the field of adherence, but also in other interventions and evidence-based pharmaceutical care studies. Professor Pintor is a member of the Scientific Committee of the Spanish Society of Community Pharmacy and a member of the European Innovation Partnership of Active and Healthy Aging of the European Commission. Our final advocate is Catia Caneiras, who is invited professor and coordinator at the Microbiology Laboratory of Environmental Health, University of Lisbon, Portugal. She holds an integrated master's in pharmaceutical sciences from the Faculty of Pharmacy at the University of Lisbon, a master's in clinical microbiology from the Faculty of Medicine, University of Lisbon, and a doctoral degree in health sciences and technologies with a specialty in microbiology. Dr. Caneiras is an elected representative of the Infectious Diseases Working Committee of the Portuguese Society of Pneumology and currently serves as a member of International Pharmaceutical Federation Commission on Antimicrobial Resistance. Over to you, advocates.
Welcome, everybody. I would like to kick off our session by just giving you an outline of what we'd like to cover today. So we're going to spend the first part of the session going through the roadmap and our progress. And we're going to spend most of the session that we've got looking at 3 case studies from across Europe and having a panel discussion around antimicrobial stewardship in action. And then we're just going to close up at the end with some thank yous. Next slide, please. So these are our meeting objectives. So I want to highlight the leadership role of pharmacists in antimicrobial stewardship. We want to drive behaviour change and commitment to antimicrobial resistance initiatives through a 3-year AMR roadmap. And we wish to share learnings and best practice from across the region to inform future initiatives in the prevention of antimicrobial resistance. Next slide, please.
Thank you. Good afternoon, everybody. It's great to be here again, 1 year later, presenting the advance of our roadmap for AMR action in Europe. Firstly, I would like to thank you, the FIP Reckitt Partnership, for inviting me today to co-chair this workshop with my colleagues Philly and Catia. It's a great pleasure. And well, we are going to look back at the roadmap that we agreed on 1 year ago in the FIP Virtual 2020 workshop. This roadmap for Europe includes initiatives that will enable pharmacy to drive mitigation strategies for reducing inappropriate antibiotic use and become AMR stewards over the next decade. These initiatives are aligned with the 3 strategic objectives of the Global Action Plan on AMR, which are firstly, to improve awareness and understanding of AMR through effective communication and training. Secondly, to reduce the incidence of infection through effective sanitation, hygiene, and infection prevention measures. And lastly, to optimize the use of antimicrobial medicines. We suggested 6 initiatives in total. You can see them here on the right, numbered A to F. They focus on 3 key action areas: education, policy, and public health, which represent the key drivers of behavior change according to the COMBI model: capability, opportunity, and motivation. 3 of the 6 initiatives were voted as the most interesting in our region. They were Initiative B, to include in the pharmacy and technician CPD and core curricula training on the role of pharmacists as antibiotic stewards, to include drivers on patient demand where inappropriate prescribing happens, and also on managing patient expectations. Initiative C, countries include pharmacists as partners in vaccination programs with roles which can range from the promotion of prevention, counseling, and detection of the population at risk to the administration of vaccines, depending on each country's legislation. And Initiative D, in their national action plans, countries include a monitoring plan of the rational use of the antibiotics dispensed in community pharmacies, as well as the development of programs for optimizing the use of antibiotics at community pharmacy setting. For each initiative, we also agreed on an implementation timeframe. Now, we are going to present the roadmap progress. So we are going to see how the top 3 initiatives are progressing so far. Next slide, please. Please note that we have filled in the table, taking into account the initiative received through the FIP AMR survey, as well as our own fundings, but there are probably more initiatives in this line. So we invite you to please share them with us whenever you can. We want this to be a dynamic roadmap in which all initiatives have a place. Well, let's review the progress that we have made on our roadmap so far. Catia Caneiras, good afternoon. I give you the floor.
Thank you, Elsa. Hello, everyone. Thank you for your presence. I'm glad to be here with you. As the first roadmap initiative, we have the main goal to include in the pharmacy and technicians as a core curricular training on the role of pharmacists as antibiotic stewardship. As main achievements, we can speak about the University of Salamanca in Spain that included a training about antibiotic stewardship, and also the Portuguese Pharmaceutical Society that it's making a complete training that includes not only the community pharmacists, but also the clinical analysis pharmacists, the hospital pharmacists, and all the overview that different career of pharmacists can, in the impact that can have on this thematic. Also, as previously mentioned by Elsa, we want to invite you to send us your initiatives and to thank those who submitted to a AMR survey the projects. Also, I want to acknowledge that Ukraine has a post-graduation on this thematic, but we would like to know more details details about it. And also University of Sevilla has made AMR campaign. We would like to way forward to the next 2 years, and we aim to integrate the European and national pharmaceutical societies as a driver for universities, and also to implement and disseminate the open access repository of materials, training, and good practice at European level. Elsa, please.
Thank you, Catia. Hello again. What are the main achievements in 2021 with regard to Initiative C? Countries include pharmacies as partners in vaccination programs with different roles depending on each country's legislation. Well, I think this is the initiative where we have seen most progress this year. As we know, the pandemic has raised awareness in the population about the importance of prevention and hygiene practices, together with the need for vaccinations. So these practices have greatly improved as a result. In general, most pharmacies in Europe have increased their competencies in the promotion of prevention, counseling, and detection of the population at risk. And in the same line, there are countries in the European Union where the population have been vaccinated against COVID-19 in pharmacies. Specifically, for example, we received an initiative from the University College of London, which ran a training course for university students to become vaccination champions and promote vaccination practices. I think this is a very relevant initiative. It's imperative to train and create awareness about this topic in pharmacy students, as they are the future of the pharmaceutical profession. And today we're going to present a Spanish initiative from the Spanish Society of Community, Family and Clinical Pharmacists, FIP, on a vaccination program for pharmacists. So this was the summary of our achievement this year. And now, what's next? Let's look at our plans for 2022 and 2023. I think we need to continue working towards these objectives. We should take advantage of the improvement that has taken place in this area, and also of the fact that the pandemic has consolidated community pharmacies as the most accessible healthcare professionals for health advice and counseling. This is therefore a good opportunity to consolidate the role of pharmacists in this field. So one of our goals for the next year is to increase the number of countries which include pharmacists as partners in other vaccination programs, not only COVID-19. And it's also necessary, of course, to continue promoting vaccination training programs for pharmacists, technicians, and pharmacy students. And finally, I think we need to focus on research and on the evaluation and dissemination of our outcomes. Now that most pharmacists in Europe have increased their competencies in vaccination and prevention practices, it's time to generate and disseminate evidence about the added value for health systems and patients of including pharmacists as partners in vaccination programs. Research, we know, that has the potential to influence countries' health policies. So let's evaluate the clinical, economic, and humanistic impact of this professional pharmaceutical service. And it's also important to focus on the process of communicating and transferring the results of our research to policymakers. Moreover, I believe that this should be a core objective for all the initiatives that we put in place. It's necessary to enhance quality research as well as the dissemination of research of results in the field of pharmaceutical care. In fact, evaluating impact and outcomes is precisely one of the FIP's development objectives for the new decade. Well, Phillip, your turn to explain the third initiative.
Thank you very much, Elsa. So our third initiative really built upon the antimicrobial resistant national action plans. And this was about having a monitoring plan about the rational use of antibiotics that were dispensed from community pharmacies, as well as actually developing programs for optimizing the use of antibiotics within a community setting. Now, we know that in most countries, probably 3/4 of antibiotics, maybe even more, are actually dispensed by community pharmacies. So this is a really important area. So what are our achievements in 2021? Well, one of the bits that has been a real focus by Public Health England, who've now changed their name to the UK Health Security Agency, whilst we've been during COVID, working with NHS England and NHS Improvement, has to try and come up with an antibiotic prescription checklist for community pharmacists. So every time a prescription will come into a community pharmacy for an antibiotic, there is a method for the community pharmacist to check that they're applying antimicrobial stewardship activities when dispensing and counselling about the prescription. And our way forward next year and the year after is we'll be sharing the tool and the results from the first year of collection, and we'll hear about this in a moment, for the paper checklist, and then translate it into other common languages across Europe for both the paper and the electronic checklist. So that's our roadmap progress and some of the initiatives that we want to focus on. Next slide, please. So what we're going to spend our time doing now is actually go through 3 of the case studies which were actually discussed on the previous slides. And then we're going to have a panel discussion afterwards. So we've got 3 speakers listed on the screen. So first of all, myself. So as in the introduction, I was a hospital pharmacist up until a month ago, but I now work as an antimicrobial stewardship lead for the northeast of England and Yorkshire. We're going to hear from Dr. Vicente Boxorli, who's a community pharmacist and president of CIFA. And CIFA is the Spanish Society of Clinical Family and Community Pharmacy. And then we're going to hear from Dr. Tiago Costa, who's a hospital pharmacist from São Miguel Unit of Health, Azores, Portugal. Next slide, please. So I'm going to start for this one. So I would like to share with you an intervention to get community pharmacy more engaged in antimicrobial stewardship. There has been guidance from the National Institute of Clinical Excellence, who are the UK clinical guideline developers, since 2015, that community pharmacy should be engaged in antimicrobial stewardship, supported by ongoing education and training. So the tool I'm about to show you has been developed over a number of years to get community pharmacy to engage in antimicrobial stewardship with every antibiotic prescription they dispense, but at the same time, not increasing the time that it takes. So an antibiotic prescription checklist was developed with practicing community pharmacists and a range of patients. It was then trialled in 12 community pharmacies after training 43 staff to increase their capability, opportunity, and motivation to check antibiotic appropriateness and provide self-care and adherence advice when dispensing antibiotics. And it has now been included in the English Community Pharmacy Quality Scheme for this year. Next slide, please. So last year, the Pharmacy Quality Scheme had some work in there about making sure that community pharmacy got together an antimicrobial stewardship plan and all their staff were trained. This year, it's around using the antibiotic prescription checklist. And over the next 2 slides, I will just show you the pictures on the checklist. So on the first slide, these are the elements of the checklist, which is initially completed by the patient who identifies the reason for their antibiotic prescription, so what type of infection they've got, any allergies, any problems with kidney or liver function, whether they're pregnant or breastfeeding, but also whether they've actually had their influenza vaccine or COVID vaccine this year. And it was also important to identify possible resistance by asking them if they've had antibiotics in the last 3 months. And then patients have the opportunity to identify any gaps in their knowledge about taking antibiotics, which is on the right-hand side. Next slide, please. So these two slides here, or the two bits on here, are what the community pharmacy or community pharmacist or the community pharmacy team complete. And so the pharmacist on dispensing records they have checked the antibiotic is an appropriate choice, the dose and duration, especially if they've received the same antibiotic previously within the last 3 months. The pharmacy staff tick to say they've answered the patient's knowledge deficits and supplied them with an appropriate information leaflet for their infection, and that they have discussed influenza and COVID vaccination with them. Next slide, please. So this year, each community pharmacy that signs up for the pharmacy quality scheme, which is most of the 11,000 pharmacies within England, is expected to do an e-learning for the use of this tool and use the tool on at least 25 occasions over a 4 to 8 week period. They need to record the intervention for the pilot onto a UK Health Security Agency website. And the pharmacy quality scheme for 2021 should demonstrate that a national approach to tailoring information to patients' needs and engaging community pharmacy in an antimicrobial stewardship whilst dispensing antibiotic prescription is possible. So I think the tool can actually be replicated across other countries in Europe with translation of the checklist and e-learning, and could improve the community pharmacy role in improving antibiotic prescribing, patient outcomes with infections, and also vaccination rates. Next slide, please. So we're going to hand over to our next speaker, who's going to be Dr. Vincenzi Buxorley, who's going to talk about his intervention. Dr. Buxorley. Dr. Buxorley, are you ready to talk to yours?
Perhaps we can move to the next presenter and come back to...
Okay. Could we move on to the next slide, please? And maybe Dr. Tiago Costa could talk to his intervention.
Sí, voy ya, ¿no?
Ah, here we go. Here's Dr. Buxorley. Previous slide, please.
Yes. Hello. Good afternoon from Spain. First of all, I would like to thank FIP and Global Respiratory Infection Partnerships. Sorry?
Yes, we can hear you.
Sí. Yes. First of all, I would like to thank FIP and Global Respiratory Infection Partnerships supported by Reckitt for the invitation to this webinar and the possibility of sharing the initiative that we have carried out from the Spanish Society of Clinical Pharmacy and Community Pharmacy on vaccination, CPD, and a Spanish repository of trained pharmacists. For pharmacists, for participants in this webinar who don't know the situation of community pharmacy in Spain, I have to tell them that the health administration doesn't allow the population to be vaccinated in community pharmacy. And with the appearance of the COVID vaccines, as a fact, we saw the opportunity to offer the help of the community pharmacists to the health authorities to vaccinate. Why? Because in December 2020, the Spanish government set the objective of reaching a minimum vaccination coverage of 70% of the population before the summer. The aim of this initiative was to enable community pharmacists to train and collaborate in vaccinating the population against COVID. The method used was to create a COVID vaccination course and the creation of a voluntary register of community pharmacists willing to vaccinate strategically outside pharmacies in those places where the health authorities require it. To this end, we undertook the following actions. First, creating a continuing education course for pharmacists accredited by the commissions for continuing education in the health professions. This course allows them training in COVID and thus be able to advise the population of the disease, prevention of COVID infection and vaccines, and training to vaccinate. Second, on 10 March 2021, we offer free of charge by email to the CEFAC Community Pharmacist database about 12,000 supporters and the Spanish pharmaceutical colleges. Third, inviting the community pharmacists that pass the training course to register in a voluntary register of community pharmacists willing to vaccinate. On 13 June 2021, the course was closed with 1,700 participants, 1,100 of whom completed the course and 1,000 were registered in the repository of community pharmacists willing to vaccinate. For action, offering to all the local health authorities in coordination with the corresponding pharmaceutical colleges the register of community pharmacists willing to vaccinate. And the 5th action, informing the media of this initiative through a press release to the media on 17 July. What results we have achieved? To have an accredited course for training community pharmacists in COVID vaccination. 101,000 trained community pharmacists to vaccinate. 1,000 community pharmacist volunteers registered in the repository, trained to vaccine, and willing to vaccinate altruistically outside the pharmacy in those places where the health authorities require aid. What we have not achieved? To participate in vaccinating the population. The health authorities refused help from community pharmacy, despite the fact that it was free of charge, the health crisis and the lack of health professionals to vaccinate. The decision was due to pressure from nurses to prevent the community pharmacists from vaccinating. In Spain, the Nurses Union has a lot of power to influence the health authorities. In addition, the involvement of nurses in vaccinations meant that they couldn't focus on attending to the population in the health centers. And what we have learned, There is a barrier called nursing that doesn't want the community pharmacy to vaccinate. We need to focus on gaining the support of pharmaceutical colleges, patients associations, and the media. We need to gaining the confidence of the health authorities in community pharmacy. It's difficult because the nursing representatives are present in the decision-making bodies of the health authorities, and they don't permit the initiatives of collaboration of community pharmacy with the national health system.
Thank you very much for that intervention presentation. Very impressive. Can we move on to our next speaker, please? Next slide. So our next speaker is Dr. Tiago Costa, and he's going to tell us about his intervention. Dr. Costa.
Thank you very much for this opportunity to speak a little about this project that was developed in the Azores archipelago, Portugal, namely in São Miguel Island. So to give you a little background information, in Portugal, pharmaceuticals are sold in the community pharmacy in predefined packages. So it's not like a unit dose system. So a patient will buy always what the size of the package that the industry has to sell. In this way, the local hospital, the only one in the island, opened a public sales unit with the unit dose dispensing system to sell pharmaceuticals, not only antibiotics, to in-house patients who have been discharged, and also patients that came from the emergency room. So patients who went to this public sales unit to have their prescriptions filled out, pharmacists and pharmacy technicians analyzed the prescriptions, and after validation, we gave the number of pharmaceuticals that were in agreement with those regimen prescribed by the physician. For that, we used the predefined packages, but we reconditioned it in new packages, in secondary packaging, with the necessary pharmaceutical units for the completion of the treatment. So in this matter, pharmacists, myself, during 1 year, took out all the information that all the prescriptions that arrived in the public sales unit, and took all the information about antibiotics, namely the number of prescriptions of antibiotics and the number of pharmaceutical units that were not dispensed to the patients. All this information was put in a digital database that was Excel, and afterwards, after we analyzed the results, we have achieved the following result: that we made 663 interventions, pharmaceutical interventions, that gave 3,939 pharmaceutical units, corresponding to 1,032.99 euros. Afterwards, we took all of this information and we used the National Institute of Statistics of Portugal with some data, and we extrapolated to a national level, and we found out that there could be a potential of savings in pharmaceutical regarding antibiotics that could achieve 1,444,317 pharmaceutical units, and could reach €500,000 in savings. So So what were the main learnings in this study? It was that the unit dose system can provide socioeconomic benefits for healthcare systems, and also prevent AMR because we stopped some pharmaceutical units of antibiotics to reach the house of patients. That publications say that they dispose them in garbage in the environment. Sometimes they give them to their friends, and this is a public health situation. Also, this taught us that package sizes made by the industry need to be assessed to comply with the dose regimen prescribed by physicians, because we saw that namely in the urinary anti-infectives and the antiseptics, aminopenicillins and penicillins and bacta-lactamase inhibitors combinations, they achieved the higher number of savings. Afterwards, I think governments, and my colleagues think that governments should implement specific rules and legislation in the antibiotic dispense circuit in pharmacies, in community pharmacies. Maybe it's time in pharmacies to create a special circuit like narcotics, not exactly, but in unit dose system, because there are few antibiotics in the market, and perhaps we need to dispense it in a unit dose system. And in hospitals, we can provide to in-house patients who were discharged with the necessary amount to complete the treatment at ambulatory care. Finally, I would like to say this study is published also in scientific in a scientific article. So if you want to see more, the link is in the end.
Thank you very much for those brilliant presentations of these 3 cases presentations. So now I will invite all the presents to submit the questions that have of these 3 cases on Q&A box. Now we have here a question, and I will ask for Phillip. How long did it take the community pharmacists to administer this intervention? You want to share with us?
Yes, thank you, Catia. So we've just done a webinar because our community pharmacists are partway through doing the intervention at the moment. So we got some community pharmacists to feed back how the prescription checklist was working. And I will share the link with you on the chat. Basically, it didn't take any extra time. So they found the best way was either the patient would fill in the checklist whilst they were waiting to give their prescription in the pharmacy, or when the pharmacist was dispensing the prescription, they got one of the pharmacy staff on the counter to complete the form and then hand it to the pharmacist when they were dispensing it. And then when the pharmacist or one of the pharmacy staff was giving the prescription, the antibiotic out, they would then just check against the list to see what information leaflet they needed and what information the patient said they didn't know about how to take their antibiotics. So the feedback from the first, and we've had 1,200 scripts so far in the first 2 weeks that it started, it said it hasn't really added anything to it. We do have an electronic version that we're developing at the moment, which we will be able to hopefully translate if people think it's useful. Because of COVID, patients aren't always coming in. And the other way that people have said that if that patients don't come and collect their tablets and they're delivered, and we're seeing this more and more during COVID, then the pharmacist can often just ring and chat to the patient over the phone. So that will add some extra time. But no, it hasn't really increased the amount of time.
Thank you, Philip. I have here also a question to Dr. Vicente. It's my question, and I will merge with Natividad Sanchez Marcos' question. That is, do the pharmacists in Spain administer the flu vaccine at pharmacies? For instance, in Portugal, we also had the same attitude that with COVID vaccination that you mentioned, but the flu vaccine at pharmacies, it's increasing and is now recognized by the Ministry of Health. In Spain, do the pharmacists administer the vaccination at pharmacies?
No, not yet. And we have been offered to the health authorities, but as I said, the position of nursing is very big. That is why we are going to replicate this initiative with the flu vaccination. This is the next step to continue increasing the number of community pharmacists trained in vaccination, to continue offering our help in successive waves of the COVID pandemic, and to replicate this initiative for flu vaccination.
In the pharmacies, I think.
The vaccines.
In the pharmacies.
Yes.
Thank you very much. I don't know, Elsa, if you have any question to our invited?
Yes. Well, congratulations to the three panelists. In my opinion, the three initiatives that have been presented today are very interesting and are a good example of the roadmap progress, and is aimed to enhance the pharmacy role as antibiotic guardians and as active agents in the prevention of infections. So congratulations. And I have a question to Tiago Costa. I like so much your project, especially for the economic evaluation that you has carried out. I think it's very interesting, this kind of results. So I wanted to ask you what the next steps in this initiative will be, in your opinion, and if you have considered transferring these results to the involved stakeholders, such as the pharmaceutical industry or the policymakers. Thank you.
Well, thank you for your question. In fact, I have shared a little bit this work with several institutions because I think it's very interesting, and to make awareness about this problematic that people are getting a lot of antibiotic leftovers at home, and articles say that they are using them in a subtherapeutic level. They are harming the environment by throwing them out. So yeah, I've shared this with a lot of entities in Portugal, international, but until now I didn't get any answer, and I think it's difficult because there is an industry lobby, and it's difficult for pharmacies here in Portugal also to implement a unit dose system. It could be in terms of antibiotic only, because they need to do several adaptations, and yeah. But in fact, I have contacted legislators about this situation, but until now, no answer at all.
Okay, thank you, Tiago. Congratulations. And I have a question for Philip too. The antibiotic prescription checklist, I think, is a fantastic tool to improve antibiotic prescribing as well as patient compliance. And this is absolutely in line with our initiative of including in the national action plans and monitoring plan of the rational use of antibiotics. And I agree with you on it would be very interesting if your initiative could be replicated in other countries in Europe. So my question is, in your opinion, what steps should other countries follow to start implementing this initiative? Which organization or stakeholders should be involved?
Yes, thank you. I think one of the ways to look at it, first of all, is for each country's pharmaceutical society or the society that looks after community pharmacy to have a look at the tool and some of the education that we provide with it, and see how it potentially could work in their own country. In England, about 5 years ago, they changed the community pharmacy contract to build in payments for doing clinical services. And so this is how it's worked well. That might not work for all countries, but I think the simple approach of getting patients to tell you what their antibiotic is for, and then letting the pharmacist check against their local or national guidelines, and then give the information that the patient wants, rather than giving the same information to every patient on there. So I would say each society, look at the information that's available. It's freely available, and we've shared the links and some of the evidence base behind it of how we developed it. And then see if it would work for them. And certainly we could work closely from England to adapt it to suit the other countries out there. But it's a tool for people to share.
Okay, thank you, Philip, and thank you for your offer. Thank you very much.
Thank you all for these presentations and for these clarifications to all the presents. And now we'll need your help, because now we'll have a votation, a pool votation with 3 questions. And at the next slide, I think that we'll have. Here is to remind you which were the 3 cases studies presented: the UK antibiotic prescription checklist for community pharmacy, the vaccination CPD and Spanish repository of trained pharmacists in Spain, and the benefits of a unit dose system in oral antibiotics dispensing in Portugal. So the questions will be: which initiative are you most likely, you are already seeing this one, to implement in your country? So we invite all of you to answer, case 1, case 2, or case 3. And I think that, I don't know if we already have all answers to this question, but please. So 50% of the participants have chosen the case study 1, the checklist for community pharmacy. Another question is, which initiative could be implemented the quickest in your country? We invite all to answer. Well, we have the same. We have the same answer to the case study 1 and to the case study 2, with 45% of answers. And now the question is: which initiative do you think will have the biggest impact in your country? Case study 1 with 45%, and then case study 2, and then case study 3. Congratulations, Phillip, as presenter of the case study 1. And now I give you the floor to finish our meeting.
Okay, thank you ever so much, and thank you for voting for England opportunity to introduce the antibiotic prescription checklist. That will then be presented as the European initiative to take forward on Tuesday, November the 30th at 11 AM Central European time. But we must make sure we try and build on all the other brilliant initiatives that we've seen. And we'll hopefully have a lively debate around there. So dial in for Tuesday, November the 30th at 11 AM. And you'll hear the debate, Are pharmacists protagonists in the fight against antimicrobial resistance? The FIP Commission on AMR, who set up the FIP Bureau in 2012, will continue to monitor the progress on the antimicrobial resistance maps each year, and hopefully be stimulating the community of pharmacists to be active agents in minimising antimicrobial resistance. And the Bureau is composed of pharmacy experts from diverse fields such as community settings, hospital settings, academia, and from all 6 regions. So thank you to Reckitt, FIP, and GRIP for supporting this. Thank you ever so much for everybody who took part in today's session. And we look forward to hearing as many ideas as you've got of how we can actually take all the range of initiatives forward. So please get in contact with either FIP directly or any of your advocates, so the 3 of us, Catia, Elsa, or myself, and we'll be happy to take some of these things forward. And it's only by working together that we can really make a really big positive impact on antimicrobial resistance. So thank you ever so much to my fellow presenters, Catia and Elsa. Thank you ever so much to our presenters as well. Thank you.
Many thanks for your attention. See you next year with lots of new initiatives.